Welcome to Chattin with the Chief, our inaugural podcast here with Dr. Kent. Good morning, Dr. Kent. How are you?
Good morning, Chief Proctor.
Thank you for joining us on our first ever departmental podcast. We're excited to have you. I'm anxious to get this kicked off the ground. This has been something we've been working on now for, I'm going to say, close to a year. So, and before I get started, I thought about this over the weekend since we're having to do take two here. But, I really need to give a shout out to our IT department. I really think that those guys and girls behind the scenes deserve a big thank you. So thanks to Skip Burchett, Ashley Beaumont for helping us put this together. This is hopefully many more to come. So I'm looking forward to it, and I couldn't think of a better person to start out with than our illustrious medical director, Dr. Stephen Kent. So good morning, sir, and thank you for joining me.
Well, you're too kind, and I do appreciate you not doing this on April Fool's Day. I would have taken offense.
I wouldn't do that to you, Dr. Kent. I wouldn't do that to you. So, my thought process to have this podcast for the department is twofold: informational and just a fun way to get information out to the staff, to be informative and educational. But first and foremost, just getting to know staff, other members of our community, members within our EMS family, just to get to know them and share information. And I think this is a good way or a unique way to do that moving forward. And so we're excited to do it. And I've got a few questions for you, if you don't mind, and we'll just get started if you're okay with that.
I'm ready.
Good. So, you've been our medical director now for how many years, Dr. Kent?
I got here in 85, and it's pretty much been almost 40 years.
Wow. So, I would say there's probably a lot of our staff that if I said, do you know Dr. Kent, our medical director, they'd say, I wouldn't know him if we walked in the room. So that's what I want to do today. Tell us about you. Tell us where you're from, what got you into EMS, what got you to being a physician in emergency medicine. Just tell us about Dr. Kent.
Well, I'm pretty much a Tennessee boy, and I have lived in Knoxville, Chattanooga, Memphis, and was going to move to Nashville to do emergency medicine when I found out about a job here in Clarksville, Tennessee, and I didn't even know where Clarksville was. So we had a young child. We decided to come up and check out a smaller community. And in 85, Clarksville was a very small community, and it was a good environment to raise a child. And so we chose to take the position here at Clarksville Memorial Hospital. And I don't regret it. I never have. Right. I was born in Cherry Point, North Carolina.
Okay.
And at a naval hospital. And while there, some of the audience may have heard of or have known Dr. William Shippen. And his father was in the Navy and was stationed at Cherry Point, North Carolina in 1954 when I was born. And so then apparently Dr. Shippen and I circled again back in Memphis. Mm-hmm. He graduated from Bartlett High School. I was a freshman at Bartlett High School when he was there. He graduated with my sister. And then we meet again in Clarksville. And so we both got our emergency medicine boards the same time. And so we're the first boarded emergency medicine doctors in Clarksville. So we've come full circle 3 times.
Small world, yep. For sure. And so a lot of our old timers here will probably remember that, but Dr. Shippen was a co-partner that worked alongside of you at the old hospital in the emergency room.
Yes. Yeah.
Right. Yeah. And so, what decided to push you towards, well, let me just start. Let me back up. What made you decide to become a physician?
I'm not sure exactly what it was. My grandfather in Knoxville was a pharmacist. His father was a pharmacist. They had the Kent Drug Store. And my father became an engineer. My mother, late in life, became a registered nurse. My sister became a nurse. And I think I had some exposure in healthcare through my cousin, who decided at a late age to go to medical school. And he is now a retired surgeon. So I had some influence. I don't know of any one event that pointed me in this direction, but I wanted a challenge, and it certainly has been that.
Sounds like it was just in the blood, honestly. Just kind of a family type deal that just pushed you in the direction of healthcare or public service.
Yes. Yeah, I do have some physicians in the family remote.
Okay.
But I was determined that I was going to medical school, and so I gave it my all, and got lucky the first time I was accepted and went to UT Memphis.
Nice. And so, became a physician. What steered you down the path of emergency medicine?
I actually, again, my cousin was a surgeon. I was influenced significantly by him, and I decided I think surgery would be an interesting profession. So I actually did 3 years of general surgery residency. But during that time, during those 3 years, I decided to do some moonlighting. So I would work in the emerge room. In fact, Team Health, that now has the contract with Vanderbilt Clarksville, used to be a smaller group, Southeastern Emergency Physicians, and I worked for them in Knoxville. And I would work these small ERs, and we'd work 12 to 24-hour shifts, and I really enjoyed it. So at some point in time, Vicki and I decided that we're going to pursue a career in emergency medicine. My class was the last class that was allowed to grandfather in. Emergency medicine is like EMS. It's fairly new. Mm-hmm. And so there were some emergency medicine residencies, but it could not meet the demand. So the board allowed an alternate pathway. They called it grandfathering in. So my class, I think, was the last class that was allowed to grandfather in. And that's what Dr. Shippen did too.
Right.
We both took the necessary prerequisites for sitting for the board, and we both passed, and then you have to recertify for the boards. And I did sit for the boards again a couple of years ago and passed again. So I'm still board certified, although I don't do emergency medicine clinically now in practice.
It hasn't been that long ago that, I can remember working some nights in an ER there in Horizon and Dixon, and we would have just a regular general practitioner in as a physician at nights seeing patients. So it hasn't been that long ago that you still had general practitioners seeing patients in the emergency department.
Yeah, that doesn't happen very much now, although, for example, if you go out west in some rural areas, you'll see mid-levels that are covering the emergency room alone.
Right.
So when I got to Clarksville in 85, we had a pediatrician that would work in the emergency room. We had an internist, Dr. Dave Gullett.
Right, yeah.
He would work a few hours every week in the emergency room. We had a general surgeon. So whoever we could get, it was when I got here, Dr. Doty and I were the full-time emergency medicine doctors, and so we would tag team it. We would do a 12 or a 24, and then Doty would come on, and I'd go home.
But to your point, though, is that it's a new field, well, fairly new in its timeline, but this hasn't been that long ago. I'm not that old, so it hasn't been that long ago when we still had non-certified board certified ER physicians seeing patients in an emergency room setting. So to your point, it's just not been that long ago that those individuals were seeing patients in the ED.
That's right. And during my lifetime, I've seen the emergence of the specialty of emergency medicine as well as EMS.
Right.
EMS didn't exist. In 54, if someone was injured, you throw them in the back of your car and you drive to the emergency room. And occasionally you would have some areas where the funeral homes would use their hearses to come pick people up because they could lay people down. There was no care rendered between, the scene and the ER. But that's kind of the mentality initially, the way EMS started. It's a scoop and run.
Right.
So that's totally changed
Sure.
over the years.
So tell us about living in Clarksville, your wife, grandchildren, hobbies. What do you like to do on your time off?
Well, thanks to you, I don't get a whole lot of time off, but I do have. We only had one child. I was too busy to entertain other children, but we have one child we've blessed, and he's a junior. And growing up, we referred to him as Scooter, but he blessed us with 3 children. He married Molly Thomas, and she's a wonderful daughter-in-law. We've got 3 beautiful grandchildren, and I enjoy spending time with them immensely.
Sure.
And I try to spend as much time with them as I can. We do have, I still have 2 horses, and I don't ride as much as I used to, but I still take the horses down to the farm and ride the horses from time to time. So.
That's kind of your getaway, right? It's the farm.
Exactly, yeah. My father introduced me to nature, and that's the greatest gift he ever gave me, and so that's my therapist. When I need to clear my head, I go to the farm alone often, and I'll just spend a few hours just walking around and enjoying nature.
So tell us, so most people probably don't know this, and so I'm going to tell on you a little bit, is tell the audience what you did on your most recent birthday.
Not the most recent, but...
well, I'm sorry. Yeah. I thought it was your most recent. Yeah. You've had so many, I've lost count. Right.
I've had... Yeah. I was a grown man, middle-aged, when you were in diapers, so, yeah. So when I was 70, my wife asked, Vicki asked what I wanted to do on my 70th birthday, and I told her I wanted to walk to the farm. So it's about a 25-mile walk, and so I was going to do a power walk. I'd done it before, a couple of decades prior. So my neighbor found out about it, and he said he wanted to go. And then an attorney friend found out about it, and he wanted to go. So the 3 of us got up at 3:30 in the morning, and at 4:30 we hit the road.
Right.
And my daughter-in-law brought us some Gatorades about halfway. It was June the 10th, and so that's usually the hottest time of the year, but we were blessed. It was not that hot of a day.
Yeah.
So we got to the farm at about 12 noon and celebrated. It was not a pretty sight, but we got there.
I came into work that morning, and I went by Hilltop just to see if I could be of any assistance. And I think I just missed you all. I think y'all were headed back down 149. I think I was a little bit late. So congratulations on your hike there. That's pretty impressive.
Yeah, I was hoping you guys would be around just with an AED, just in the event.
Right. Well, I was trying to get to you, but I missed you. So congratulations on that. This was a huge feat. Tell us, give us some history on you becoming our medical director for the department. Tell us what that was like.
Well, it was pretty much a given that the medical director would be a physician that worked in the local ER, and we only had one ER. So it kind of fell on me by default, and so and I enjoyed it. And emergency medicine and EMS is kind of a kinship type careers. I always thought, being an emergency medicine doctor, that I was on the front line, but not so much when it came to EMS. EMS. They're on the front line, and they don't have a controlled environment that they work in. It's very chaotic out there.
Right.
And they're working all hours of the day, which emergency medicine doctors do too, but we don't work out in storms and in the rain and in freezing cold weather, trying to administer life-saving measures to our patients. So by the time you guys bring us the patient, we've got plenty of help. The resources, we all complain we don't have enough resources in the emergency room, but compared to being out in the field in EMS, we have ample. Mm-hmm. And so but I enjoyed as a young physician. Emergency medicine is a very, very fun profession to practice. It's adrenaline rush all the time. And I've worked with some very, very good nurses, and I've worked with some very, very good mid-levels. And we've had some paramedics and EMS personnel work in the emergency room as well. So they...
What? So, what did the county reach out to you to be the medical director for the department, or how were you approached about being our medical director?
Wes Klein was the chief at the time,
Yep.
and Wes Klein, I think, approached me and asked me if I would agree to be the medical director, and I agreed.
And the rest is history.
The rest is history.
The rest is history.
Yep.
So to go back to what you said a minute ago about being in an uncontrolled environment, out in the elements, so on and so forth, we contrary to what people believe, we're all the time out preaching and teaching about what we do here at the department to anybody that wants to listen. And it's a lot of times that we talk about what we do, what this department does day in and day out for the community. And one of my slides in the PowerPoint presentation is a car upside down in a field with the paramedics engaged in patient care underneath the vehicle. You can't see the patient, but you can just see that the providers are communicating with the patient through the vehicle. And I tell them all the time, I'm like, and the caption above the picture is "our office," and the looks on people's faces in the room is just, their mouths hit the floor because they really never think about it in that capacity. So, yes, limited resources, environments could be 30 degrees outside, snowing, raining, whatever the case may be. So, hard job. The girls and guys here at the department that make that happen do a phenomenal job with it, and it's tough. It sure is. And so, but they do a phenomenal job. And I'll tell another story on me is when I was on the truck, and yes, I was on the truck at some point in my career. I'd come in the mornings and I would ask, who is on today over at the emergency department? That's back when we were still next door at Clarksville Memorial. And when I found out Dr. Kent was the physician on during the day, I was like, oh, no, are you kidding me right now? So you just had to be on your A game, right? I mean, I couldn't be bringing patients into the emergency room with our medical director, not making sure that all my I's were dotted and T's were crossed. And, I mean, you kept us on our toes. You still do. And that just made all of us better providers. But yeah, I wanted to make sure that every time that I brought a patient in, that I didn't need you confronting me in the corner that I'd done something wrong, because you can be a little intimidating.
Well, apparently I mentored you well, because I hear the same thing about you from your staff.
It was good though. I mean, but I did. Like I said, I was like, "Is Dr. Kent on today?" They're like, "Yeah." I'm like, we'd make phone calls next door. It's like, "Who's on today?" It's Dr. Kent. Oh my goodness, are you kidding me right now? So yeah, it was intimidating at times, but at the end of the day, you're very professional, and intimidating is not the right word. It was just constructive criticism was always good, and we preach that today, is that what we do is very important out in the field, and if you can't take constructive criticism, then that's a challenge for us, right? We have to be able to take constructive criticism, because what we're doing is a very important life-saving skills. And we have to learn from our mistakes, and constructive criticism is very huge in what we do, every day. So, just had to tell myself a little bit about, knowing you were taking our patients every day when we were bringing them in.
Well, I appreciate you sharing that with me, Chris. But no, I do expect excellence, or at least people to strive towards excellence. And I think that the current leadership at Montgomery County EMS feels the same way. And I think that generates a lot of feeling of pride among your staff and helps your morale to know that they work for a really, excellent EMS. And there's some out there that don't do a good job. I mean, when we take trips, occasionally I'll see an accident and I'll run to attend, and I'll work with some other paramedics, and I'll see what they do, and I think if this was in Montgomery County, I think it would have been done different and better. But so I'm proud to be part of the organization.
Yeah, no, I am too. It's been a blessing for me for the past 30 years. It's easy to talk about when you've been around a department for 30 years and it's been good to you, and I have no issues getting up and preaching about how good this department is and the people that make this department. It's real easy to talk about, and I'm blessed to have been a part of it for many years. And so let's talk just a little bit about our trip in February. We went to Gatlinburg to the TASA Midwinter Conference for EMS, and I think you were awarded some prestigious award. Do you want to tell us a little bit about that?
Yeah, and I was quite honored and surprised. Chris had asked me if I wanted to attend the TASA meeting in Gatlinburg that they have every year, and I don't know that I've ever been to that one in Gatlinburg. I think I've been to a TASA meeting before. So I said, sure, I'm available that week, and he led me to the meeting, and Billy Webb, for some reason, came. He was a past chief.
Yeah.
Thought that's a little unusual, but he sat at our table, and anyway, when it came to awarding the best medical director of Tennessee by TASA, they called my name, and it totally floored me. I was totally unprepared, but quite honored. Yes,
well deserved. Congratulations. We couldn't think of a better medical director for that to go towards, and so well deserved. And I'll tell a little bit on you as well, because you probably won't say it, is up till this year, your services to the county for being our medical director have been at no cost to the community, which is huge. A service our size, as big as we are, most medical directors charge an annual fee. And like I said, up till this year, you have not. And so that's to be commended. And congratulations on that. And it was well deserved.
Well, thank you. Clarksville's been good to me, and it's kind of my way of giving back. And this really is a wonderful city to live in. When I went through the Leadership Clarksville program here in Clarksville, it allowed me to see so many parts of the community that I was not familiar with. And so we spent a day with the legal community and a day with Fort Campbell. And so every day that we would spend would be on some area of Clarksville that you usually don't get access to. And so I'm very proud of Clarksville. It's I think that you and I both are living in an extremely exciting time for healthcare. We're fortunate that Vanderbilt now is the sole owner of the hospital here. So Vanderbilt Clarksville. And they are great partners with our EMS program.
Yes.
And now we have St. Thomas, and we have HCA TriStar, both announcing that they will be building hospitals here in Montgomery County as well.
Yep.
Just phenomenal. And we've always enjoyed good leadership here in Clarksville.
Yes.
I think, like I'd mentioned, Ted Crozier was the mayor when I got here, and we've had several mayors since. I like the fact that the county and the city mayors, they work well together usually, and so that results in good efficiency. And it seems like the mayors have always been supportive of EMS.
Oh, 100%. The city mayor, Mayor Pitts, Mayor Golden, they're always very supportive of us. Easy to contact. I could reach out to either one of them anytime and get anything we need. our county commission, our EMS committee, they've always been supportive since I've been in leadership to our department, and we couldn't do what we do every day without their support. So we've been blessed by our county leadership and ensuring that what we have is what we need to be able to respond to the calls for service. And we're on tap to again be around a 8 to 10% increase in call volume for 2026, which marries what we've seen in the past couple of years, about 8 to 10% increase in call volume. And so, when you have those kind of increases in call volume, you still need resources. You need more resources, more manpower, more equipment, more training. And our leadership, our county mayor and county commission have been very supportive, and we're blessed by that. So yeah, it's phenomenal opportunities here in Clarksville, Montgomery County. We're anxious to see what healthcare looks like in the coming years. So thanks for bringing that up. I appreciate that. So as our medical director over the past several years, tell me what you have seen change. There's got to be a lot of changes, right, between protocols, the medications, procedures. What have you seen it change and evolve over the past several years?
It's the staff are certainly becoming more professional, and there's an enormous amount of training that's going on in your department, and I like that because it's no longer the scoop and run mentality. It's right. If somebody has a cardiac arrest on the scene, they may be out there for 20, 30 minutes.
Right.
And if there's an extrication, a prolonged extrication, they may be out there for a prolonged time. So there's a lot of physicians initially resisted allowing pre-hospital personnel to do procedures out in the field, but now we're getting away from that. And with the new technology, there's more and more opportunities for paramedics, EMTs, AEMTs to do hands-on and make a difference and save someone's life. And I'm sure that you could sit there and cite example after example on lives that have been saved because your people responded. Not only, they have to get up in the dead of night and be on the road within minutes,
right?
And but they got to safely drive to the scene and address. And who knows what situation they're going to walk into. It may be a 1-year-old. It may be a 99-year-old. It may be a car accident. It may be a burn victim. You just never know for sure what you're dealing with until you get there. So I've enjoyed watching the growth. I think that it's going to continue with AI. I'm really looking forward to where we're going from here. We're in the middle of rewriting the protocols.
Yep.
And I think that our department liberalizes the protocols a little bit more than a lot of EMS programs because they're so well trained.
Good.
And we have a good quality assurance program where we oversee what's done in field. And I'll be teaching a cricothyrotomy class here the next few weeks where we're teaching the paramedics how to do surgical airways.
Right.
Who would have thought, when I started this 40 years ago, that we'd allow a paramedic to do a surgical airway, and that's a surgery.
Sure. Well, and on top of that, correct me if I'm wrong, but you're looking to liberalize that as well, right?
Yeah, we're looking to liberalize that so that, seconds count,
sure.
When you're dealing with an airway, and so they don't have time to call medical control
right.
and wait 5-10 minutes for an approval to do a surgical airway. That's got to be done immediately. Yes,
right. Absolutely, that's fantastic. And so yeah, we'll get the protocols wrapped up soon. We'll get those pushed back out to the protocol committee that we formed months ago that helped put these new protocols together to kind of get their review on it and get their blessing. And then once those are all ready to go, we'll push it over to our app people that have our protocol app so they can get those embedded in there, and along with our medications, put all that together, and we'll roll that out after some credentialing. So that's exciting news coming down over the next few months. So we're excited to get those behind us for sure. And then we'll get busy on something else to keep the department moving forward.
You never have to worry about running out of things to do.
No, we don't. No, we don't. So speaking of that, is there anything as our medical director that you would anticipate that you'd like to implement, after we get the protocols solidified and implemented? Is there anything as our medical director that you would like to see changed, added, taken away, improved? Your thoughts on the future of our pre-hospital medicine?
Nothing really other than the fact that I want to be there to assist. I want to help facilitate and enable things to happen and allow a lot of the vision to take place with the current leadership. And I think we're going great places. I trust the leadership. And so I think it's, I want to be part of it's at my age, I want to be part of a winning team and contribute and feel like I've done something worthwhile. And I think working with Montgomery County EMS has been very rewarding in that respect. Good.
We feel the same way. So, as our medical director, you also wear another hat as medical examiner for the county. Tell us a little bit about what that looks like for you every day. What does that entail? Does it keep you busy? I mean, tell us a little bit about that.
Yeah, Dr. Doty, my partner for decades in the emergency room, who's now in hospice, had a horrific injury to his arm, and he was the medical examiner at the time. And he asked me, I was the assistant medical examiner, and he asked me if I would assume that role. And so I did. I didn't know how long I would do it, but it's as time has gone on, I've gotten used to doing it, and I enjoy it. And it's challenging, and I work since I've already entrenched with the Montgomery County EMS. I work with the paramedics with overseeing the medical examiner role. I interact with families. I interact with the healthcare community, not only in Montgomery County but all over the country. Clarksville gets a lot of travelers down 24. So we get people traveling, and they may be several states away that they live, and I've got to track down medical records. If they need autopsies, I set up an autopsy to be done. It's a forensic autopsy, and it's interesting too in the fact that we've got so many different jurisdictions in this area. I mean, we border Kentucky, so we've got another state. These people may live in Kentucky and be driving through Clarksville. And we've got Fort Campbell Army Base, federal jurisdiction. Some of their aircraft sometimes may crash in Montgomery County. And, I'm quick to release jurisdiction to them. So it's sometimes it gets sticky, but I enjoy it. And again, the DA's office and the mayors have been very supportive in my ability to perform this, and I've really enjoyed working with the funeral homes.
Yeah.
I mean, we've really got some good funeral homes here in this area.
We do. They've been very easy to work with. They've worked with us in times of need, and so yeah, we're blessed to have them here. But most people probably don't realize that we have the morgue here at our administration building for EMS. What does that? How does that help you? Does it hinder you? Tell us a little bit about having the morgue here locally.
Yeah, that's significant. In the past, we used to have to barter with local funeral homes to use their morgue, and then the hospital has a morgue, but it would fill, and so when they built the new station here, they included a morgue, and it's been a great asset.
Yeah, I don't think people realize that that's a secondary part of our job that entails a lot of time and energy is managing the morgue. And so it's something they didn't teach us in school. We had to kind of do some OJT and when it came to operating the morgue and having family visit their loved ones and so on and so forth. So yeah, it's been an interesting challenge for us, to say the least. just having them work here in our department. So I don't think most people would know that.
Yeah, and I'm hoping that I know you probably were going to bring this up, but you've been to the mayor and to the county commission requesting some funding for a death investigator.
Yep.
And I think that'll just increase the level of medical examiner services that we offer. And we need it. This community is growing.
Sure.
And it's not only with it affecting your EMS operation, but also the medical examiner
Right.
position.
Yep. Sure. I don't disagree. Let's just hope we're able to successfully get that into our budget this upcoming fiscal year. So I think we're wrapping up our time here. But before we go, I just want to give you the opportunity to end on any kind of statement, any kind of topic you want to talk about, something that maybe most people don't know about the Dr. Kent. Is there anything else you want to divulge or let the audience know about you that we don't know already?
Well, I would be in trouble if I didn't mention my loving wife, Victoria Kent.
Yeah.
And so I'm blessed. She's been very supportive of my. I've given a lot of time to my career, and so it's taken away from her, and it's taken away from my son, and it takes away from my grandchildren. But they've been tolerant, and so I'm very appreciative of that. And Vicky stays very active, doing some real estate management. And my son's very active. He works with Clarksville Gas and Water, and then he works weekends sometimes, Ashland City Fire Department.
Nice.
And plus he knows how to do a lot of other things that, he knows how to work. One time I told him the brakes on my truck were bad, and so it was going to cost me, I think, $600 or $800 to fix them. And he said, we can do that. And so I was a little incredulous, but sure enough, 2 hours later, I had new brakes on my truck.
Well, thank goodness he got his capabilities through his mother.
Well, I was wondering, at the end of the task, I was wondering, whose son are you?
Right. Well, again, thank you for being with us this morning. It's been a pleasure speaking with you and having you on our first inaugural Chattin with the Chief podcast, for many more to come. Our relationship's done nothing but grow and get better, and I can't think of anybody else that I'd want by my side as we continue moving our department in a positive direction as we grow and respond to more calls year after year. So thanks again. Look forward to more conversations and more, bigger and better things for us. So thanks again for being with us this morning.
Well, thank you, Chief, and I hope you stay with the department for many, many years to come.
Yeah, we'll see about that for sure. So we'll hope to be putting this out on our YouTube page in the future in April. I say the future, that's just tomorrow, right? Tomorrow's right. April 1st. So we'll push that out on our YouTube channel, and hopefully Spotify will be where the audience will be able to listen to these moving forward. So thanks again to our IT department, and thanks for joining us with this first inaugural episode, Chatting with the Chief.
Thank you. I've enjoyed it.
Thanks, Dr. Kent.